In today's Doctorvention, most of us know that October is Breast Cancer Awareness Month. And as Elizabeth Hurley said, early detection is key. Breast cancer has touched just about all of us, whether you're a patient, a loved one, or a caregiver. The very words breast cancer strike fear into women everywhere, and for good reason.
The statistics are frightening. About 1 in 8 women watching this show right now will develop invasive breast cancer. This year alone, more than 230,000 new cases of invasive breast cancer will be diagnosed in women. Of that number, nearly 40,000 will not survive. But with awareness, women are facing the disease head-on. Pink has become the global symbol for the war against breast cancer. Every year, thousands pound the pavement across the country, racing for a cure.
Well, there's no cure, but there has been a major development in the fight against breast cancer. Information presented at a recent breast cancer symposium suggests that patients who take the anti-cancer drug Tamoxifen for at least 10 years can boost their chances of beating breast cancer. Now, Tamoxifen is one of the most widely used drugs in the battle against breast cancer. And joining me now to talk about this breakthrough and prevention is Dr. Lisa Hopkins. She's a breast surgeon from St. Peter's University Hospital. Dr. Hopkins, thanks for joining me.
Thank you.
So what's your take on this Tamoxifen study?
So as you mentioned, we've been using Tamoxifen for a while to treat a certain type of breast cancer. And traditionally, we've been using it, women take it one pill, they take it once a day for 5 years. The newest study showed that there actually may be a little bit of a survival benefit if they take the pill for longer, up to 10 years. You know, it's still early in the study, but it's promising. There are some side effects, though, with Tamoxifen, as most people know. So in order to make a really informed decision, a patient needs to have a conversation, a thorough, in-depth risk and benefit, analysis with her medical oncologist.
Right. The side effects being commonly fatigue and hot flashes, and I think the survival benefit was something like 2%. So a lot of people say, well, 2% is so small, but there are millions of women that take Tamoxifen, so it could be a significant number.
Exactly. And some of the earlier data showed that there is a decrease in the risk of recurrence as well. So that translates eventually to, though it's small, but a survival benefit.
All right. Now, your hospital, St. Peter's University Hospital, has started a community outreach program and specifically targeted toward young women. And the goal is to increase breast cancer awareness among female athletes in high school and college. So when you're looking at a video from a recent session at a high school in New Jersey, the message was the key to the cure is early detection. So how important is this message to get out to young people?
Well, we traditionally think of breast cancer as affecting women 40 or even older women, but every young woman has a mother, possibly a sister, a cousin, an aunt, a coworker. So the more people that are aware of breast cancer and early detection, the better.
Right. Now, we've had a lot of celebrities recently that have, been free to discuss their breast cancer. I mean, Christina Applegate had breast cancer. Wanda Sykes recently came out. Now, Christina had a family history, and Wanda had early-stage breast cancer, but both women decided to go for a double mastectomy. What do doctors tell people about whether or not they should get the mastectomy or whether they should? What do they usually tell people?
Well, one of the great things these days is we have different treatment options for women. Years ago, the only option we had was mastectomy, and now the majority of cancers can be treated by doing just a simple lumpectomy, removing the cancer and removing a normal rim of tissue around it. In many cases, there are women, for various reasons, who could still have a lumpectomy but would opt to have a mastectomy for other reasons. It's a very personal decision. It's a decision that needs to be made after a thorough discussion between the patient and her surgeon.
Yeah, at the end of the day, I think a woman has to be comfortable with the decision. It is ultimately her body and her choice. All right, let's talk about mammograms for a minute, because in the news media there's been so many studies, so confusing to women. When should I get it? Is it 40? Is it 50? Is it 30? What do you tell people?
So the current recommendations, despite all of the confusion and everything that's been out there, are that women should begin getting screening mammograms, the average risk woman, at age 40, and they should get them every year afterwards, along with a clinical breast exam by her physician. All
right, so at the end of the day, there are some guidelines, but again, speak to your doctor, because if you have a high risk, it might be earlier.
Absolutely.
All right, Dr. Hopkins, thanks so much for coming. Really appreciate it.
Thank you.
Up next, do you want to make food that will not only taste good, but will boost your immune system? How about learning from Master Chef Marcus Samuelson? He's here with a very special correspondent, too. Find out who when we get back.
This portion of Dr. Steve is brought to you by St. Peter's University Hospital, New Brunswick, New Jersey.